24.
السيدات والسادة الحضور، الرجاء أخذ مقاعدكم لبدء الحفل. Ladies and gentlemen, please take your seats. after. السيدات والسادة الحضور، الرجاء الوقوف عند المقدرة للسلام الملكي السعودي. Ladies and gentlemen, please rise if able for the Saudi national anthem.
"100 years ago, health looked very different. Antibiotics didn't exist. Surgery was often fatal due to infection. Diseases like polio were endemic. Mental health was poorly understood, and average life expectancy was just 40 years. Humanity has overcome many of these challenges, but this success has highlighted new challenges. The world was still recovering from the Spanish flu pandemic, which left health systems facing significant challenges. This crisis highlighted the fragility of healthcare infrastructure at the time. Endemic diseases like tuberculosis and malaria posed a serious threat, with high mortality rates in poor and crowded areas. This led to the first International Malaria Conference in Rome to address the crisis. The health risks of industrial labor were becoming recognized, prompting the International Labour Organization to adopt a convention. This initiative aimed to compensate workers for diseases caused by unsafe working conditions. Mental health awareness was low, and treatments were often harsh and ineffective. This led to many patients being isolated in distant asylums, highlighting a major challenge. In 1925, King Abdulaziz established the Public Health Department in Mecca. Public health and ambulance were established to meet the needs of the kingdom's health and environmental sectors. This was a crucial step in modernizing healthcare, especially for pilgrims visiting the country. In 1928, a discovery changed the course of medicine forever. The Scottish physician and microbiologist Alexander Fleming introduced penicillin, the first antibiotic, a triumph that saved millions of lives. The old reactive model of treating sickness is changing and must change. Health has entered a new era. From an era of managing disease to a new era of maintaining wellness. And as the venues for health interventions grow beyond hospitals and into homes, or even into the palm of your hand, this new era of well-being will need unprecedented collaboration between governments, between sectors, and between nations. The era of wellness relies on the spirit of collaborative innovation. Here, the entire health ecosystem converges. Innovators, investors, and decision makers from every continent. Country pavilions showcasing national innovation. Specialized zones covering every aspect of healthcare. Here, where local solutions go global. Where partnerships form and will define the next decade of health. The Global Health Exhibition 2025 doesn't just showcase the future of healthcare, it creates it. Life is health. Innovation is health. Evolution is health. Success is health. Prosperity is health. Health is the one and only asset essential to all life. Invest in health. Create, generate, innovate to better heal and protect the world with the new means of today. The Global Health Exhibition 2025, where innovation meets investment meets impact.
Please welcome to the stage the Haluf spokesperson, Yasser Al-Husseimi.
بسم الله والصلاة والسلام على أشرف الأنبياء والمرسلين سيدنا محمد وعلى آله وصحبه أجمعين. السلام عليكم ورحمة الله وبركاته. Your Highnesses, Excellencies, esteemed guests, good morning, and it's an immense privilege to stand before you today in this vibrant, forward-looking city of Riyadh to welcome you all again to the Global Health Exhibition 2025. To be here in the heart of a nation that is not just participating in the future of healthcare, but it's actively building it through its ambitious Vision 2030. This year's theme is to invest in health. It's a simple phrase, but its meaning is boundless. It's a call to action that extends far beyond the financials. It's about investing our intellect, our passion, our courage, and our collective will into a healthier future for all. So let's invest in health, in tech for the good of health, and in manufacturing in the good of health as well. Let's invest our time in meaningful conversations. Let's invest our expertise in solving the unsolvable, and let's invest our hearts in the belief that together we can build a world where health is not a privilege for a few, but a reality for all. So without further ado, please join me in welcoming on stage for the opening speech, His Excellency Fahd Al-Jalajal, Minister of Health in the Kingdom of Saudi Arabia.
أصحاب السمو والمعالي والسعادة، الأصدقاء والزملاء من مختلف أنحاء العالم، السلام عليكم ورحمة الله وبركاته. نجتمع اليوم على منصة ملتقى الصحة العالمي في نسخته الثامنة، المنصة التي تجمع صناع القرار والمبتكرين والمستثمرين ليصنعوا معاً مستقبلاً صحياً أكثر ازدهاراً واستدامة. في المملكة العربية السعودية نحظى بدعم لا محدود لكل ما يجعل صحة الإنسان أولاً في هذا الوطن وفي كل أرجاء العالم، بقيادة مولاي خادم الحرمين الشريفين الملك سلمان بن عبد العزيز حفظه الله. وبمتابعة حثيثة من سمو سيدي ولي العهد رئيس مجلس الوزراء الأمير محمد بن سلمان حفظه الله. الحضور الكريم، هذا الملتقى أحد ثمار تحولنا الصحي، نجتمع فيه كل عام لنناقش التحديات العالمية في القطاع الصحي، ونشارككم مسيرة تحولنا الصحي في المملكة العربية السعودية، ونستعرض ما تم وتحقق من المبادرات التي أعلناها في النسخة السابقة، ونعلن معاً وسوياً إطلاق حزمة جديدة من المبادرات والابتكارات لنساعد العالم في إيجاد حلول للقطاع الصحي. الحضور الكريم، العالم اليوم يواجه تحديات صحية متصاعدة، من ارتفاع عبء الأمراض المزمنة إلى تضخم تكاليف الرعاية الصحية، ومن تزايد أزمات الصحة النفسية والإدمان إلى تفاقم تحديات القوى العاملة الصحية عالمياً، حيث تشكل الأمراض المزمنة أكثر من 74% من الوفيات حول العالم، وتحصد سنوياً حياة أكثر من 42 مليون إنسان. كما تجاوز الإنفاق الصحي العالمي 10 تريليون دولار سنوياً، وارتفع الإنفاق الصحي على الفرد بأكثر من 60% خلال العقدين الماضيين. ورغم هذا الإنفاق الهائل، ما زالت كثير من الأنظمة تبحث عن التوازن بين الجودة والاستدامة، وهنا يأتي دور الابتكار والتعاون الدولي لنصنع معاً مستقبلاً صحياً أكثر إنسانية واستدامة. الحضور الكريم، أتاحت لنا رؤية السعودية 2030 فضاءً رحباً لنغير المشهد الصحي في العالم. انتقلنا من العلاج بعد المرض إلى الوقاية قبل المرض، ومن الاستثمار في الألم للاستثمار في الأمل. هذا الاستثمار يبدأ من اللحظة الأولى. نموذج الرعاية الصحية السعودي الحديث يرعى الإنسان قبل أن تبدأ حياته، ونخطط له قبل زواج والديه. استفاد من الفحص الطبي قبل الزواج 6 ملايين زوج وزوجة، وارتفعت نسبة الاستجابة للمشورة الوراثية من 15% إلى 85%، وقرابة 3 ملايين مولود بدأت حياتهم عبر برنامج الفحص المبكر لحديثي الولادة. وأصبحنا نكتشف نكتشف قرابة 70% من حالات السرطان في مراحلها المبكرة. وبفضل الله ثم بفضل هذا التحول انخفضت وفيات الأمراض المزمنة في المملكة بنسبة 40% متجاوزة مستهدف الأمم المتحدة بخفض الوفيات من الأمراض المزمنة بمقدار الثلث. شكرا للشركاء في الصحة في كل السياسات للعمل بنهج الحكومة الواحد. وبفضل الله انخفضت وفيات الحوادث المرورية بأكثر من 60% متجاوزة مستهدف منظمة الصحة العالمية بخفضها للنصف. شكرا لجميع الشركاء في السلامة المرورية. هذه الإنجازات مجتمعة تقودنا للإنجاز الأثمن، إنجاز الحياة. في عام 2016 كان متوسط العمر المتوقع في المملكة 74 عام، واليوم يسعدني أن أعلن تجاوز العمر المتوقع في المملكة 79 عام بفضل الله. هذه رؤية 2030، هذا تحولنا الصحي، وهذا نهج الحكومة الواحدة. الحضور الكريم، في النسخة السابقة من الملتقى أطلقنا مبادرات أصبحت اليوم واقعاً ملموساً. في النسخة السابقة دشنا اتفاقية توطين إنتاج الأنسولين، واليوم بدأت المراحل الأولى من التصنيع. شكراً معالي وزير الصناعة، شكراً معاليك، جهودكم في الصناعة أثمرت. في النسخة السابقة أطلقنا التوأم الرقمي، اليوم أصبح في تطبيق صحتي بين أيادي جميع المواطنين. في النسخة السابقة وعدنا بدعم التجارب السريرية، اليوم زاد عدد الأبحاث السريرية بنسبة 51% عن العام الماضي، بدعم من منظومة البحث والتطوير والابتكار. وأشكر معالي أخي سواحة على هذه الجهود. كذلك شهدت النسخة السابقة توقيع اتفاقيات في التقنيات الحيوية، واليوم مستشفى الملك فيصل التخصصي ينتج الخلايا التائية بالكامل لعلاج بعض أنواع الأورام، في إنجاز يؤكد قدرة المملكة على أن تكون وجهة رائدة عالمياً للصحة المتقدمة في المنطقة. وشكراً لمعالي الفياض دكتور ماجد على هذه الجهود. بالإضافة لذلك عرضنا الجيل الثاني من تأكد، هذا النموذج الذي أعلناه في النسخة السابقة يأتي استمراراً لمنهجنا في دمج الخدمات الصحية في المجتمع وتقريبها للمواطنين. اليوم تبدأ الصحة القابضة استقبال أوائل المستفيدين في مراكز تأكد. هذا الأسلوب الفريد من نوعه تقدمه المملكة نموذجاً للعالم في تقديم الخدمات الاستكشافية في منشأة غير تقليدية. الحضور الكريم، نواصل مسيرة الابتكار بإطلاق مبادرات نوعية ليستمر الوعد وينمو الطموح. نواصل بناء منظومة صحية تمكن الابتكار والاستثمار في صحة الإنسان. نعلن عن حصول شركتي هيومين ولين على موافقة هيئة الغذاء والدواء السعودية للبدء بتجربة سريرية للطبيب الذكاء الاصطناعي AI Physician، والتي تعد من أوائل الدراسات السريرية في هذا المجال عالمياً لاكتشاف أفضل السبل لاستخدام ودمج قدرات الذكاء الاصطناعي المتقدمة في تشخيص الأمراض بدقة وتقديم إرشادات الرعاية بشكل مباشر. واستمرار في توطين الصناعات، يسرني أعلن اليوم عن عزم شركة الاستثمارات الدوائية السعودية لايفيرا لتوطين صناعات عدد من اللقاحات، وذلك بالتعاون مع شركات رائدة عالمياً مثل سنوفي وميرك وفايزر. وفي خطوة أخرى غير مسبوقة على مستوى وطني، وتجسد ريادة توطين الذكاء الاصطناعي لخدمة الإنسان وتفتح عهداً جديداً للرعاية الشخصية الذكية، يسرني أن أعلن أنه بالشراكة مع شركة جوجل نطلق اليوم المدرب الصحي الذكي، حيث تصبح التقنية أقرب من أي وقت مضى لصحة كل فرد. وسيكون متوفر على تطبيق صحتي قريباً، ليكون المرشد الصحي الخاص بكل مستفيد بين يديه في تطبيق صحتي. الحضور الكريم، أشكر جميع الشركاء على استثمارهم في الصحة. ومن ملتقى الصحة العالمي يسعدني أن أعلن أننا سنشهد في هذا الملتقى توقيع اتفاقيات واستثمارات تتجاوز قيمتها 124 مليار ريال سعودي. فلنواصل هذا الطريق، طريق الابتكار، طريق الشراكة، طريق الوقاية، ودمتم جميعاً بصحة.
Thank you, Your Excellency, for this inspiring opening speech. And before we get into our second segment of the day, which is announcements, we are honored and thrilled to have joining with us for a special announcement, virtually all the way from Washington, D.C. Put your hands together for the inspirational Her Royal Highness, Princess Rima bint Bandar Al Saud, Saudi Arabian Ambassador to the United States.
بسم الله الرحمن الرحيم. أصحاب السمو والمعالي، الحضور الكرام، يسعدني تواجدي معكم اليوم في ملتقى الصحة العالمي الذي يجمع نخبة من الخبراء وصناع القرار والجهات المعنية من مختلف دول العالم. ومراعاة للضيوف الكرام من حول العالم سأكمل حديثي بالإنجليزية. Good morning everyone, and I'm so sorry I can't be with you in person, but I'm truly grateful for this opportunity to speak with you. First, allow me to extend my deepest thanks to His Excellency Fahad Al-Jalajil, the Minister of Health, for his gracious introduction and for his unwavering leadership in advancing Saudi Arabia's health agenda. Your efforts, sir, along with those of many dedicated partners, are transforming lives every single day. And today, as we mark our 10th anniversary of 10KSA, I'm proud to announce the launch of our 2025 campaign in partnership with the Ministry of Health and the General Secretariat for the Ministerial Committee for Health in All Policies. This campaign is a nationwide international effort to raise cancer awareness by bringing communities together in a shared commitment to health and hope. This moment is deeply meaningful for me as it brings us together in a shared commitment to raise awareness for all types of cancer. That means we're investing in health, and we're investing in each other, and we are investing in a healthier society globally. What started as a spark of inspiration has grown into a movement, uniting families, friends, and neighbors in the pursuit of better health for all of us. Because true change begins when we empower one another to take those very first steps. As frightening as it may be, we have to start with raising awareness, and that starts with knowledge, uniting a society to support one another. And for example, while inherited genes play a role in cancer, they account for only 5 to 10% of all cases. And the vast majority are linked to factors that we can influence through our lifestyles, our environments, and our daily choices. And we make those every day, ladies and gentlemen. This underscores the critical importance of early detection through regular checkups and screenings, and adopting a proactive approach to our health, not as an option, but as an essential part of our lives. When we take control of what we can change, we not only reduce our risks, but we also greatly improve our chances for successful treatment and recovery. That's why we're calling on every single person, every young and old, man and woman, from every corner of our nation and beyond, to make informed, proactive choices about their health, and we're asking you to do that starting today. Together, we can turn awareness into action, and action into absolutely lasting change. And on Monday, December 8th, 2025 of this year, we invite you all to join us in showing your support by forming a lavender ribbon. We've chosen a weekday to commemorate our 10-year milestone because we want this to be accessible to all, whether you're at work, in school, or in your home. No grand venues required, just your commitment and creativity. And you might wonder, why lavender? Well, lavender's the universal color representing all cancers, symbolizing solidarity for every individual and every family. It's a color that will unite us in purpose and in pride. So how can you participate in this campaign? What can you do? Well, we're inviting everyone to get involved with 3 simple yet very powerful ways. First and foremost, own your own health now. We ask you to pledge because no one else can do this for you. Be your own health champion. Inspire those around you, your friends, your family, and colleagues to do the same. Get screened. Get tested, because small steps today lead to stronger tomorrows. Second, on December the 8th, gather with others, whether colleagues at the office, students in classrooms, families at home, or neighbors in your community, and form a lavender ribbon. Wear shades of lavender, stand together in the shape of the ribbon, and capture that moment. Or let your creativity shine. Draw it, paint it, design it digitally, or even assemble it using lavender-colored objects or elements from your home. The possibilities are endless, and every ribbon will tell a story of unity. And third, and equally important, share your lavender ribbon with us. Share it on social media. It may feel like a small gesture, but when we all do it, we create waves of awareness that reach far and wide. And tag us at 10KSA 2025 and use hashtag 10KSA. Include a caption about your actions and why are you doing this. Let's amplify our voices and show the world the strength of our collective commitment. By joining us, you'll help more people grasp the vital role of prevention through regular checkups and screenings, which can lead to earlier diagnoses and ultimately, ladies and gentlemen, they can save lives. And so we invite you, everyone, come join us. Let's stand together for health today, on December 8th, and every single day. Because together, we will build a healthier future for ourselves, our loved ones, and our nation. I thank you for your participation. I thank you for your passion, and I thank you for your partnership in this journey. Remember your commitment to screen, because early detection is the way forward. And together, ladies and gentlemen, we are unstoppable. Thank you.
Thank you, Your Royal Highness, for this inspiration. We will see you and meet the rest of you on December 8th, joining this amazing cause campaign. And now, to go on with our announcements, please welcome on stage again His Excellency Fahad Al-Jalajal, Minister of Health in the Kingdom of Saudi Arabia. Tfaddal Malik. These major announcements are a testament for the continuous support of investments and innovation flywheel that supports health transformations from the kingdom to the world. And we will be doing it in 4 domains, starting with our first domain in digital health. Please join me in welcoming His Excellency Abdullah Swaha, Minister of Communication and Information Technology. And now, please join me in welcoming Muna Al-Mhaid, VP of Humane. and Mr. Muhannad Al-Rashid, CEO of Lean. This is a partnership to launch an AI physician clinical trial to test how we can complement our physicians, enhance clinical decision, and bring precise medicines to every patient. Thank you all. And now join me in welcoming on stage Mr. Will Ahmed, CEO of WOOP, and Mohammed bin Ammar, Deputy Minister of Defense for Center of Excellence. This is a joint development agreement to advance digital health, quality of life, and integration of health and clinical data. Thank you, Mr. Mohammed bin Ammar. Thank you, Mr. Will. And now, please welcome on stage Tara Brady, President, Europe, Middle East, and Africa at Google Cloud. Together, they're launching the AI Health Coach, serving as a personal health guide for every user. Thank you, Your Excellency Swaha, for joining us for this domain of investing in the digital health. And now with our second domain, life science, medtech, biotech, and pharma. Please welcome on stage His Excellency Bandar Al-Khraif, Minister of Industry and Mineral Resources. Accompanied with Mr. Raed Ismail, MENA Direct Investment at PIF. And Mr. Vivek Bachwat, CEO of Lifera. And now, with the first announcement of the life science, please welcome on stage Frederick Odea, Chairman of Sanofi. This is an MOU for the localization of vaccine manufacturing in Saudi Arabia. Thank you. And now for our next announcement, please welcome on stage Joseph Romanelli, Human Health International President at MSD. This is an MOU to evaluate the localization of vaccine production in Saudi Arabia. Thank you. And now, please welcome on stage Mr. Nick Loganwich, President of Emerging Markets at Pfizer. This is a non-binding MOU to explore opportunities in localizing biopharmaceuticals in the Kingdom of Saudi Arabia. Thank you. And now please join me in welcoming Mohammed Yusuf Jamjoom, Chairman of the Board at Jamjoom Pharma. Together with Lyfera, they are investing for vaccine localization and manufacturing in the Kingdom of Saudi Arabia. Thank you, team from Jamjoom Pharma and Lyfera, for being with us for these announcements. And now, please welcome on stage Tom Poland, Chairman and CEO of BD. This is a strategic partnership to localize medical technologies, deliver clinical training, and build capabilities with an investment value of 1 billion Saudi riyal. Thank you. And now please welcome on stage Mr. Khalid Hawarniya, President of Arabian Trade House, accompanied with Mr. Mohammed Hawarniya, VP of Arabian Trade House, and Sandrine Charvet, VP and Senior Director Operation at Fresenius Kabi. This announcement is to establish a factory to localize medtech manufacturing of blood bags with an investment value of 1 billion Saudi riyal. Thank you. And now please welcome on stage Mr. Abdullah Al-Mani, Chief Executive Officer at Al-Mani Group. This is an agreement for manufacturing ultrasound imaging devices with an investment value of 330 million Saudi riyals. Thank you, Mr. Abdullah. And now join me in welcoming on stage Dr. Abdul Rahman Sabra, General Manager at Roche Products Saudi Arabia. They are partnering with the Saudi Ministry of Health to build clinical research capabilities with an investment value of 20 million Saudi riyals. Thank you. And now please welcome on stage Chris J. Cockings, Executive Vice President of Diabetes Care at Abbott. This partnership fosters innovation and establishes a digital health R&D hub and continuous glucose monitoring sensor manufacturing. Thank you. And now please welcome on stage Dr. Bernd Ones Orge, President EMEA at Siemens Healthineers. They are aligning with the Saudi Arabian Ministry of Health to establish the Shift Innovation Center in Riyadh, aiming to elevate regional excellence in health innovation and research. Thank you. And now, please welcome on stage Roy Jacobs, CEO of Royal Philips. This is an MOU to strengthen the healthcare ecosystem and advance care delivery through technical capabilities, including AI-enabled healthcare. Thank you, Mr. Roy. And with that, we come to the total investment value in the life science domain with over 2 billion Saudi riyals. Thank you, Your Excellency Bend Al Khraif, for joining us for this domain of life science. Shukran ma'alik. And with our third domain of the day, hospitals and infrastructure, we'll start by welcoming on stage Dr. Fawziya Al Jarallah, Group CEO at Hayat National Hospitals. This is a strategic investment plan for growth, innovation, and healthcare excellence, expanding capacity to 15 hospitals and more than 4,000 beds, with an investment value of 7 billion riyals. Thank you, Dr. Fawziya. And now please welcome on stage Dr. Jawad Zakaria, VP of Actidal. Actidal Group is Morocco's leading private healthcare group with over 42 hospitals in Morocco, and announcing a strategic expansion in the kingdom fully aligned with the Vision 2030 with an investment value of more than 5 billion Saudi riyals. Thank you very much. And now please welcome on stage Mr. Nasser Sultan Isbai, CEO of Muasat. Muasat are expanding with plans including hospitals in Jeddah, Yumba, Abha, Al-Ahsa, Al-Qatif, Al-Khubar, and many more cities with an investment value of 5 billion Saudi riyals. Thank you, Mr. Nasser. And now please welcome on stage Naif bin Abdullah Al-Rajhi, Vice President, Member of the Board at Al-Rajhi Medicine. يلا حيه. Al-Rajhi Medicine is advancing healthcare in the Kingdom of Saudi by establishing new specialty healthcare centers with an investment value of 4 billion Saudi riyals. Thank you, Mr. Naif. And now please welcome on stage Dr. Shamshir Failil, Founder and Chairman at Burjeel Holdings. The company has signed an MOU to invest in different healthcare specialties with an investment value of 3.7 billion Saudi riyals by 2030. Thank you. And now please welcome on stage Dr. Walid Ftahi, Founder and Chairman of the Board at IMC. They're creating a unique model for holistic treatment and patient experience in Saudi Arabia and expanding in Mecca, Uhud, Ubhur, and in medical education as well, with an investment value of 3 billion Saudi riyals. And now please welcome on stage Bassam Shaheen, CEO of SMC. They're investing in 3 advanced hospitals and independent primary health clinics with an investment value of over 3 billion Saudi riyals. And now, please welcome on stage Giorgio Chiellini, Director of Football Strategy at J Medical. A legend on and off the pitch, with a strategic collaboration to localize world-class sports medicine services in Saudi Arabia with an investment with over 500 million Saudi riyals. And this, Your Excellency brings the total investment value in hospitals and infrastructure domain to 31.5 billion Saudi riyals. With our last domain of the day, venture capital and investment funds, please welcome on stage Michael Yee, co-founder and partner at Hill House. This is a collaboration to support localizing pharmaceutical industries and advancing innovation with an investment value of 5.5 billion Saudi riyals. Next, please welcome on stage Mr. Abdul Latif Al Fawzan, Chief Operating Officer at Al Fawzan Holding Company. An investment into the next generation of Saudi clinical infrastructure with an investment value of 2.5 billion Saudi riyals. And now, please welcome on stage Dr. Helmut Schweizler, Chairman and CEO of TMV Capital Healthcare. They're expanding their network of rehabilitation hospitals and long-term care facilities with an investment value of 1.5 billion Saudi riyals. And now, please welcome on stage Dr. Ibrahim Al-Najashi, co-founder and board member at Saha Capital, accompanied with Ms. Latif Al-Hadib, CEO of Isnad Financial Company. Together, they're launching a Sukuk program bridging the financial gap across the healthcare and biotechnology sectors with an investment over 1 billion Saudi riyal. Next on stage, please welcome Dr. Kamel Garibi, Chairman of GKSD Investment Holding. He's also calling His Excellency Minister of Health from Egypt with us. Thank you very much for joining. This is an investment value of over 1 billion Saudi riyals. Thank you. And now, please welcome on stage Cornelia H. Janel, Managing Director of Coltrack Ventures. Coltrack Ventures are establishing Saudi Arabia's first industrial biotechnology growth fund with an investment value of 940 million Saudi riyals. Thank you. And now please welcome on stage Dr. Yazid Al-Sufyani, General Partner and CEO of IB Ventures, a national biotechnology investment and venture building initiative with an investment value of 175 million Saudi riyals. And last but not least, please welcome on stage Mr. Joshua Ford, Managing Director at Sanabil Studio by Redesign Health, accompanied with Ms. Sarah Mubarak, Head of Sector Development at Sanabil Investments. Mr. Joshua, you're rocking the thobe. This deal is launching up to 20 new startups and healthcare companies. Thank you very much. And with that, Your Excellency, the total investment value in the VC and investment funds domain is over 12 billion Saudi riyals. which brings us to a grand total of all of our announcements that we announced in this segment alone, over 46 billion Saudi Riyal. Thank you, Your Excellency, for joining us for this segment. This segment, we shared over 46 billion among the 120 billion that is going to be part of our 4 days journey here at Global Health Exhibition. We encourage all of you to bring forward your investments for the next year and be part of this group of pioneers who come here year after year to invest in health. And now, without further ado, we would like to welcome our first keynote to the stage, titled National and Global Healthcare Policy and Investment, brought to you by His Excellency Professor Dr. Khalid Abdel Ghaffar, Deputy Prime Minister for Human Development and Minister of Health and Population at the Arab Republic of Egypt.
Thank you so much. Good morning. بسم الله الرحمن الرحيم. في البداية اسمحوا لي أصحاب السعادة والمعالي، الأخ العزيز معالي الوزير فهد الجلاجل وزير الصحة، والزميلة العزيزة معالي الوزيرة جليلة وزيرة الصحة بمملكة البحرين، وكل قيادات وزارة الصحة بالمملكة العربية السعودية، وكل الأصدقاء. يعني أنا أرى كثير من الأصدقاء في مجال الصحة العامة. الحقيقة سعيد أن أنا أكون موجود النهاردة في هذا المجتمع وهذا المؤتمر. أنا بالنسبة لي أول مرة أحضره، ولكن الحقيقة أنا مبهور بحجم الحضور وأيضا بالتنظيم الرائع من المملكة العربية السعودية، وده ليس بغريب. عندما طلب مني أخويا معالي الوزير فهد الجلاجل أن أنا يعني أحضر the Global Health Exhibition and Forum, I was very delighted